Okay, so hello everybody. So today we're going to learn a little bit more about labor and delivery, which seems to be a hot topic and a hot little area for any of those students that are interested in healthcare. And today we have Julie with us. So Julie, thank you so much for being able to talk to the students a little bit about what it is that you do. And if you don't mind, just kind of giving us a little introduction to who you are and where you work,
Mhm.
and then how did you get into this field?
Yeah. My name's Julie. I grew up here in the Quad Cities. I went to Bettendorf High School. After Bettendorf, I went to the University of Iowa to study nursing. I was always interested in helping people and in healthcare in general. Classes I liked in high school that helped me to go into nursing. I liked my science classes. It doesn't necessarily mean that you have to like love chemistry. I don't know if anybody loves chemistry who's a nurse, but if you like biology or if you like learning about the body, like anatomy and physiology with how the body works, those are good classes to take in high school. And then I went to Iowa's nursing program, which is a 4-year program. There are programs that you can go to that are shorter in length, and those are like Scott Community College offers a program like that, Blackhawk, and then there is a local 4-year program at St. Ambrose has a nursing program as well. So plenty of nursing programs in the country, and they kind of vary between a 2-year degree and a 4-year degree. The 2-year degree is a little confusing. It's a little false advertising, I should say, for 2-year degree because you need to do about 1 to 2 years of prerequisites before you do the 2-year nursing program. So nursing programs in general, you typically can't do any faster than about 3 years, unless in high school you take a lot of college classes at the same time.
Yeah, very good information. You're right. Depending on what the student's looking for, community college could be a great start. Otherwise, going straight to that four
Mhm.
year. So, when looking at nursing, obviously, you need nurses and doctors for every single part of your body.
Mhm.
And so, how does the curriculum or the classes change? How do you decide labor and delivery, and how do you
Mhm.
get there opposed to a different focused area?
Yeah. Throughout, once you're into the nursing program, which is usually the junior senior year, you do you have different clinicals. So you learn, you might be in a semester that's talking about women's health, pediatrics. So during that women's health pediatrics, you're in the classroom learning about that topic. And then you're also attending clinical at maybe the NICU or a pediatric floor, a pediatric office. And then you're also doing your labor and delivery rotation during that time as well. So that gives you that ability to test and try the waters in different areas. So you're working with nurses in those different specialty departments. And so when I was in college, I fell in love with the curriculum part of women's health, and I found it very fascinating. So then I hoped that I'd like it when I was at the bedside learning about it, and then I loved it. And so that's what then helped me know, okay, I want to do women's health. I love labor and delivery, and then now I've been here at Genesis my whole career. I've been here for 26 years in this department.
That's wonderful. So really, any kind of nursing program, I guess that's a really good question
Mhm.
for students that are interested, like saying, I know I want to do healthcare, I know I want to be a nurse. So they're going to have the
Mhm.
opportunity to kind of rotate
Yep.
through different areas to find their niche. Okay, that's
Yep.
perfect.
They'll even do. Some people get a school nurse experience opportunity for clinical. Some do home health, like VNA type services. So it's not just hospital based. Sometimes there's also surgery center or community health based clinical rotations also. So that's valuable for students to try different things out.
Would you say there's a high demand for labor and delivery?
There's a high demand for all kinds of nursing. Right now, uh, yeah, it's a wonderful profession to go into. There's so many different areas. So say you do, I mean, most people don't stay in one area as long as I have. I'm just very passionate about it. Um, but yeah, yeah, there's jobs everywhere. We've got positions open. Every department at Genesis has positions open. Every hospital in the country has positions open. So the schedule is very flexible. The money is getting better and better because, especially since COVID with the nurse shortage, I've gotten more raises in the last 3 years than I've had ever. And so that also raises the base pay for nurses coming in who are just starting out their occupation too. The flexibility in the schedule for like work-life balance, most nurses who work in the hospital work 3 12s a week. That's either 3 12s at nighttime from 7 p.m. to 7 a.m. or 3 12s a week from morning, 7 a.m. to 7 p.m. So it's either night shift or day shift. And we work every third weekend here at Genesis, and that's pretty common nationwide that nurses work every third weekend. So if you're somebody who doesn't want to work weekends ever or doesn't want to work holidays, nursing is definitely not for you unless you want to just work in an office because you're going to make a lot more money in the hospital, but you are going to have to work. Usually most nurses start at night shift and then eventually get to day shift, but weekends and holidays are always part of the package. That's just something you get used to. And it's something that my family has easily adapted to. I think another thing that's kind of interesting or is my daughter has chosen to be a nurse also. So she's in her senior year of nursing program right now. So obviously that she hasn't been scared off by the fact that I have, work every other year on Christmas or things like that. So she realized that it's a great opportunity to always be able to have a job and never to be without a job. And if you want to change areas or departments or hospitals every couple of years, you can totally do that too. And there's not a lot of occupations have that much flexibility.
Well, I'm really glad you brought up the schedule because
Mhm.
that is exactly when I'm talking to students. Yes, you need to kind of figure out what profession you're interested in, but you also need to know what type of human you are, right? So,
Yeah.
are you going to be able to work a third shift job? Are you open
Mhm.
to doing,
Mhm.
the 3 12s, like you said? Are
Yeah.
you going to be okay
Yeah.
with missing holidays and working weekends and working
Mhm.
evenings? And because that is
Yeah.
a requirement. I mean,
Yeah.
especially with healthcare, right? You want
Yeah.
to make sure someone's there to take care of you if you're sick. So
Yeah.
nursing has its benefits, and then you have to decide if the schedule then fits into what you want your
Mhm.
lifestyle to be. So that's wonderful.
Yeah.
And I
Some
love
of our
that you,
nurses too. Oh, sorry to
oh,
interrupt.
please.
Some of our nurses too, a lot of hospitals have what's called a weekend option program. So some of our nurses that are new moms, they actually take the weekend option program. So they work Friday, Saturday, Sunday, and then they have off every week, Monday through Thursday. So what they can do is they can cut down to almost no daycare, healthcare, daycare costs at all for their children because they provide their children's childcare Monday through Thursday. They just need coverage on Friday if they work day shift, and then their significant others can take care of the kids on the weekends. So we've had nurses who, because childcare, I keep saying healthcare, sorry, childcare is so expensive. So if you can eliminate that, and then the nurses who work the weekend package, there's a huge bonus. So they get paid a lot more than I do, even after being here for 26 years. So kind of just some cool things in flexibility for, yeah, kind of the finances of nursing too.
I love that. Yeah, because that's not,
Mhm.
I don't think, very well known, right? Like that there's
Mhm.
all this flexibility and these options for time. So thank you for sharing.
Mhm.
What would you say is your typical, and I know that's probably hard to say, but what does your typical day look like? What you come
Yeah.
in, what are you expecting?
Yeah. On day shifts, so on day shift, when we come in at like 6:45, 6:50 in the morning, we're going to get one of two things. We're either going to get a patient who's already in labor, like who's doing it on her own or is already being induced. Induction is when somebody's got a medical problem and we need to get them to have their baby. So maybe they've got high blood pressure or they're having twins or they have diabetes or something might be wrong with the baby. We're going to induce those women because it's no longer safe for them to continue on with a pregnancy. So I'll either have women who are in labor on their own, or I'll have a patient who is going to be induced so that we're going to give her medication to make her have contractions and get her labor going. So I do, of course, check my patient's vitals, assess them, do a really thorough, in-depth head-to-toe assessment, make sure all their health systems are good before we start. I'll start her IV. I'll draw her labs to send those off to labs so that we know all the background information we need to about her. Our patients are really good about getting prenatal care. So usually they've been seen somewhere here in the Quad Cities. And then we've got that prenatal record. So then I go through that prenatal record from the last 9 months with kind of a fine tooth comb and kind of jot down a list of what are her risk factors, what do I need to watch for? Because as a labor and delivery nurse, I'm caring for her the whole day. I think a lot of people think like, oh, my doctor's there. Oh, my midwife's there. Yeah, they might be, or they might not be, literally. It's your labor nurse who is checking your cervix to see how far dilated you are. We're putting the baby on the monitor and we're watching and charting every 15 minutes for how your baby's doing, because we can't see your baby. All we have to go by is the baby's fetal heart rate. And so we take courses in fetal heart rate monitoring so that we can make sure that your baby is safe all the time. So honestly, the baby, the fetus is like 51% of my job. And then the mom's like the other 49%. So helping her then cope with labor, do different position changes. I am in her room all the time, helping her breathe and cope and do position changes. We've got birth balls and birthing chairs and all these different positions that we do with our moms to help the baby navigate the pelvis to make it easier for her to deliver. If she wants pain medication, I'm the one giving her pain medication in her IV or calling the anesthesiologist and helping position her during the epidural placement. Also at Genesis here, like say there's an emergency, which unfortunately we have happen a lot. If there's an emergency, and she needs to go for an emergency C-section, I am the nurse that goes to the operating room with her. So I'm also an OR nurse along with being a labor and delivery nurse. We cross-train all of our labor and delivery nurses to operating room nursing so that our patients don't have to go through a change of nursing. Because if I've bonded with you all day, caring for you, and now all of a sudden we have an emergency, think how scary it would be for the patient to go, oh my gosh, like Julie's leaving me and now it's just some random nurse and I don't even know her. Is she going to take care of me? And it's just not safe. It doesn't make the patient feel safe. And it also is hard because in an emergency, me giving a report to another nurse and passing a patient off, there can be a lot that's lost in translation there and isn't communicated well. So yeah, we do vaginal deliveries, we do C-sections. It's cool. And all of our nurses too are then trained to mother baby. So some days I come in and I've got 3 moms and 3 babies and helping with breastfeeding and education for how they can care for their babies safely at home. And then I assess the moms and assess the babies as well. So all of our nurses in our department learn 2 of the 3 areas. The third area is called the nursery nurse. Sorry, I've got a pop up on my.
Oh no, I think we lost her. So while we wait for her to come back on, that's a lot of information that I wasn't aware of. I didn't know that as being somebody who has given birth. Oh, here she is. As being somebody who's given birth, I didn't realize that they're cross-trained. And so I think that's super cool that you are going to have your nurse stay with you the entire time. So Julie, as we lost you there real
Sorry.
quick. No, that's okay. It happens. Welcome to, virtual world.
Yeah.
I was just saying, I didn't realize as somebody who's given birth, I didn't realize that cross-trained and you're going to have to, I love that you are going to be that stability for that patient.
Yes.
Because I think that's so important. And I love that you also touched on, a lot of times, if you've not been in the situation, you don't realize the different roles that nurses and doctors play. And you are so correct. Like my nurses were the ones that were there with me the entire time. I maybe saw my doctor when they were catching the baby, and then that's
exactly. That's exactly right. I think if people have it in their head, like, oh, my doctor, my midwife, it's like, oh no, we manage all of labor and delivery. If we have an issue, we are the eyes for the physician. So when there's a change in the fetal heart rate, or if I have a concern, I need to contact them and let them know if they need to come in or not come in. They might be 20 minutes away at the office. They might be in their house sleeping. If it's nighttime, they don't have to sleep at the hospital. But it's just nice. And at Genesis, not all hospitals cross-train their labor and delivery nurses to the OR. So for example, at the University of Iowa, they pass off their patients. They have a separate OR team. So I think that, I don't know nationwide, I guess, the breakdown of how many hospitals do it like we do or not, but I do know our patients really appreciate it. And as a nurse too, I've been with her all day. I've bonded with her. I want to know how that C-section goes. I care about her and I need to see it through. Otherwise it would create great anxiety for me to pass her off to somebody else and then to be wondering and worrying for an hour, hour and a half of how the mom and the baby are doing. So I really like that we have that continuation of care. And it's crazy. Nursing is crazy. I think I'm partially addicted to a little bit of the adrenaline high. I mean, some days are very calm and normal, and then other days are just nuts. The babies are popping, and it's just it's a flurry of every day is different. And so I think that's what attracted me to nursing is that I feel like I could continue to be challenged. Although sometimes it's exhausting, it's also really rewarding to have a job where I don't know what's going to happen each day. I show up and what happens is what happens. And I have to continually be thinking about, have I seen this before? What does this mean? Oh, I remember the last time I saw it, this happened, or maybe I should try this, which I think is why it's important that nurses stay in their specialty area for a while. Because you don't have that retrospect if you haven't been in a specialty area for a long time.
So I love that. Yeah, nursing, I think in any focused area on nursing, you just don't know what's going to happen or what you're kind of walking into. But
Mhm.
obviously there's goods and bads with healthcare.
Yeah.
So,
Yeah.
what I always try to tell students is as long as you like your position, your career, 80% of the
Mhm.
time, you're golden,
Mhm.
right? There's no position
Mhm.
that you're probably going to like 100% of the time. So what would
Right.
you say are the biggest challenges of your role?
Yeah. I think, I mean, to be completely honest, it truly, the healthcare crisis that we're in right now of the vacancies, we are at a different time. I mean, the world of healthcare looks very different now in 2023 than it did in 2019, early 2020. For the first 20, 23 years of my career, we didn't have the shortages. I mean, our department wouldn't even have an opening. You'd have to work like on the cardiac floor for a few years before you could even get into labor and delivery, to the birth center. But now there are openings. We do see a little bit of a higher turnover. Um, I do think that there's not enough people that are prepared coming into nursing. I don't think they realize that it's physically exhausting. I don't sit at a desk all day. I'm tired when I go home. I don't have anything left to give. At the end of a 12, I'm done. I go home, I take my shoes off, I take a shower, hopefully I eat something and I go to bed, and then it's just a kind of like a repeat. So it's physically demanding, it's emotionally demanding. If you've got a patient who's got a mental health issue, it's psychologically demanding because women with mental health problems also have babies. So I would say that it's not just like when I was going in through nursing school, I'm like, oh, I get to take care of people and I get to heal people and everybody's happy that I'm caring for them. That's not always the case. But I think what's really hard is those first 2 years of nursing, your nursing career are just very, very difficult. And we do lose a percentage of people in that first 2 years because it's hard to work night shift. It's hard, like you said, to adapt with your family, to miss, um, to miss a holiday. I always tell people, talk to your families about changing. I mean, like Thanksgiving can be done on Saturday, or, my kids, when they were little for Christmas, they didn't know, it's not like they're looking at a calendar. They didn't know that Santa came on the 25th instead of the 26th. So we would move things around. But I think that's what's hard is that people think like, oh, 3 12s a week, that's so easy. It's nice. It's really nice to have 4 days off a week, but it is hard to adjust to. And I think people just need to give themselves time and grace to really adjust to that. But it is sad when we lose a nurse with less than 2 years experience because they've learned a lot. We've put a lot into them to train them, but they're still in that novice state. Those first 2 years of nursing, nurses are considered a novice. They're not considered, they're proficient, but they're not in those higher levels. And so it is hard when we lose somebody to like an office or something like that. It's like, oh gosh, you went to nursing to be this high level and give this high level care. And now you're going to do a set of vitals in room patients, at a doctor's office. So I would say that that's the challenges. Pay used to be a challenge, but the money it's good right now. So um, I can't complain about that anymore. We're definitely getting reimbursed more than we used to. The other challenges would be, I think people think like in healthcare, everything is maybe not all healthcare, but in labor and delivery in the birth center, I think people feel like it's rainbows and unicorns and butterflies, right? Everything is perfect all the time and great all the time. And it really is most of the time. But we have situations where a mom is laboring and the baby comes out and the baby is doing great. And then the mom starts to hemorrhage and, she's bleeding way too much. And now we have this emergency situation on our hands. And it's very, very hard to watch somebody your own age or someone you've cared for all day who's young and healthy, who's now having a postpartum hemorrhage, of which we know if we can't stop it, she could die. I mean, women die in childbirth. Many, many women die in childbirth or following childbirth due to hemorrhage. So there are crises and emergencies that we have during labor that can result in a C-section, or during a C-section or after a vaginal delivery. Women can have bleeding problems, and those are hard. It's hard because then we go kind of like from a labor and delivery nurse to like an ER ICU nurse, but yet we don't have ER ICU training. And we didn't go into this area wanting to do that kind of trauma nursing, but sometimes we have to. So that is very challenging. And then for the mother component of it, and then as far as the infant component of it, I mean, we have babies who are deceased in utero before they come to us. Maybe the mom hasn't felt the baby move. She might go to the office, or she might come to us saying, hey, my baby's not kicking as much. I'm worried. And then it's nurses who we put her on the monitor and then we can't find the heart tones. And so we're that person for her until the physician can get there or until the ultrasound can get ordered. And it's really hard to watch a mom find out her baby in utero has passed away, has died, or a recently delivered mom whose baby dies after childbirth. Just very, you just don't forget them. We don't have it happen very often at all, but yeah, you cry on the drive home and you think about them a lot over the weeks and months to come. And it's hard that way. I think it's different than, if you worked maybe on a cardiac unit and you've got a 95-year-old who has a heart attack and dies at 95, you can kind of be like, well, they had a good life. They're 95. And, it's sad to see their family grieve, but you can kind of like rationalize that there's that life, death, circle of life, so to speak. But for our area with young, healthy women and new babies, death is not something that we ever anticipate. And so it's hard. And we don't have many, thank goodness, but yet, but they're really, really bad. They're really hard. And so you do kind of carry some of that with you.
That's a really good point. I think in all healthcare related fields, you're going to have death,
Mhm.
unfortunately. And I do think that that would
Mhm.
be more difficult with being with the babies and the younger mothers doing that.
Mhm.
We do have a question in the chat. How did you know that labor and delivery is exactly what you wanted to do right away? Was that
Mhm.
from the rounds that you did?
Yeah, so in the classroom at Iowa, my professor, I don't know, every once in a while you'll have an instructor or professor, you're like, oh my gosh, I want to be just like you. Like, you're the greatest. Just that first lecture, she started talking, and she was a midwife who also had her doctorate. And so, oh, just listening to her, like I hung on every word. And of course, I'm female. So then it's like, maybe I'm just interested in this area because, like, I wanted to have babies someday. So I thought at first, maybe I'm just interested in women's health because I get it a little bit, right? The menstrual cycle wasn't too hard to learn because I'm like, well, I have a period, So you're kind of going through that class and you're like, oh, this isn't too bad. But I thought she was really great. And then my rotation, that first day of clinical, I'm like, oh, I am home. This is what I love. Some nurses go do like a med surge or like a cardiac, or they'll go to kind of a general population for a couple of years and then go into a specialty area. they used to say that that was a good idea, but I was so I was just addicted, I think, from day one, from that first clinical experience that I had. And University of Iowa's patients, where I had clinical, very different than here. I actually didn't love University of Iowa's patient population as much as I like it here at Genesis. At the University of Iowa, they have all the inmates. They have all high risk moms. And so I liked it, but I wasn't 100% sure if I liked it at the University of Iowa. So what you do in nursing is there's a preceptorship, kind of like how teachers do a student teaching. Nurses do like a student nursing for their last semester. They get placed in one area and they're immersed in tons of clinical hours. So I had to do 300 hours in an area that I chose. And so I chose labor and delivery, and then I chose it here at Genesis. So I would commute up for school, but then I would work here at Genesis one-on-one with a labor and delivery nurse. And that's where I'm like, oh my gosh, patients aren't shackled to the bed here because they're not inmates, and not everybody has 5 babies in them. They're not all high risk. And this is so great. Not everybody gets an epidural, and women can walk around the room and deliver in their hands and knees and do all these cool positions when they labor. Whereas the University of Iowa is mostly like high risk, you're in bed. It just was a different feel to it. So then during my preceptorship, after just a day or two in this preceptorship, I'm like, oh yeah, I thought I really liked it, but now I absolutely love it. And then why I started here was when I was a student, they offered me a job. They're like, you want a full-time job, night shift, labor and delivery, all you have to do is pass boards. So they offered me a job during that preceptorship, which happens a lot because if you do a good job during your preceptorship, they want to hire you, as a nurse if they have an opening. And that is a lot how we get a lot of our candidates now for the positions that we fill. And so for any of you that are interested in healthcare at all, the biggest thing I would suggest is get your CNA, get that certified nursing license. Oh my gosh, get it. Like, it's not cheap. It's like 5 weeks. And I know it's expensive course, but nothing is going to let you know more about if you can handle being a nurse than being a CNA. And a CNA is way harder than being a nurse. It's, oh my gosh, most days it's a thankless job. So if you get your CNA license and work as a CNA, preferably at a hospital, and get some experience, you're going to see nurses interacting with patients, but you're doing the grunt work. Being a CNA is definitely the grunt work. But if you can do that for a few years while going to school and for nursing, you're going to be the best nurse out there, because that experience is, oh my gosh, it's just invaluable. So I was, even though I went to the University of Iowa, I worked summer vacations and winter vacations here at Genesis on the cardiac unit. So I had worked that patient population. I'm like, I know this is not where I want to work, but I was working as a tech. So I was helping open heart patients, bathing them, taking them to the toilets, helping feed patients, changing their bed baths, vital signs, all those great things, which then just prepared me so that when I was in nursing school, I wasn't scared to talk to a patient or touch a patient. It's like I've been doing it for a couple of years. So I cannot speak volumes. Don't get that job at Subway. Don't work at a gym or Starbucks. Get into healthcare and start to realize, like, okay, this is hard work, moving patients and doing kind of this. It's very difficult work, but it's invaluable. And that'll really help you know if you can handle being a nurse, because you might wipe 3 bottoms in the first 4 hours as a CNA, and you might go, okay, like I can't do stool, so I'm not going, I can't be a nurse. Or I saw somebody throw up blood and then I passed out. Okay, well then there's no point going to nursing school if you can't handle being a CNA. So my daughter is a CNA here at Genesis too, even though she goes to college in South Dakota for nursing. And she's in ICU. So she's seen crazy things here in ICU, but that has helped her know, like, but she saw those things because she was a CNA. So it really has exposed her to a lot. So definitely, like, yeah, get your CNA, get working. Oh, sorry, go ahead.
No, is the CNA required for nursing?
I'd say probably 95% of nursing programs do require a CNA. Yeah, but Genesis, you don't have to have your CNA to get a job here. So if you wanted to like not spend the money, not take the 5-week course, you can, it's called a PCT or a patient care tech at Genesis. So you could become a PCT, they'll on the job train you. If you have your CNA, you do get paid a little bit more money. And then, like I said, most nursing schools will require the CNA, but becoming a patient care tech, even without that CNA licensure, is just a great, great thing to do. The pay is okay. It's not great. But you got to tell yourself, it's like, okay, this is not for the money. You know, I can waitress and make more. Okay, fine. So maybe have a part-time waitressing job, but then have a part-time PCT or patient care tech job so that you're getting that exposure. So I do think a lot of people who go into nursing weren't properly, just didn't realize what it was going to be like. And so why waste your time and money studying and paying for college if you find out, you know, once you're finally into the nursing program and you're finally doing clinical, you're like, I can't stand this, or I'm scared to talk to a patient or clean somebody up after they've had, you know, an accident. And so that's my number one tip.
Well, and I'm glad
apply
you
to a
said
local
that.
hospital or nursing home, you know, a hospital ideally.
Yeah, my
Yeah.
whole role is to help them get exposed to possible
Yeah.
careers and do things like this so that they go, oh, I
Mhm.
might need to rethink that, right? Or, oh, I didn't know
Yeah.
that was part of that. So with
Yeah.
the PCT, if
Uh-huh.
you don't know this, that's okay. For all of you who are listening, I can find out. But is there an age requirement and do they have to have their high school diploma?
I believe at Genesis I believe it's 18 and you need your diploma. However, for the seniors in your group that know they're graduating in June or whatever, and you know, their grades are fine now, I believe they could actually already interview and kind of hold a position for those jobs and then to be able to easily roll out. So besides being a staff nurse here on the birth center, I'm the educator for the department. So the last 8 years, I've been the educator. So I set up people's preceptorships, and we have, you know, like nursing students who job shadow and do things like that. So there's tons of patient care tech openings. None on our unit. We don't use patient care techs. Ours are called OB techs, and it's a kind of a different job title, but the rest of the health system uses patient care techs, and there's always openings. They can mental health for adults, mental health for children, the OR, outpatient, the surgical floors, the cardiac floors. Yeah, everywhere has a need. The ER.
That's
So
great.
yeah, it's pretty cool.
Well, Julie, I could
Yeah.
talk to you all day long. You are amazing and you're giving out phenomenal information, but I definitely want to be cautious of your time and the school's time.
Yeah.
So I just want to say thank you, thank you, thank you for having this conversation
Yeah.
with us today. Like I said, I know a
You're
lot
welcome.
of students who are interested in the healthcare field go babies, right? And there's
Mhm.
just so much more to it. But if that's really
Yeah.
what you're passionate about, obviously you show how passionate it is about what you
Mhm.
do. So thank you so much.
Yeah. Did you want to see a labor room really quick? I'm sitting in one.
I mean, if that is okay, yes,
Yeah.
please.
Yeah. Well, first of all, I've got this amazing view. We're 5 stories up. So how nice when you have a baby that you can look out the windows, right? That's not what you're doing when you're laboring, that's for sure. But there is this great couch here. We just got brand new couches actually yesterday. The top part folds down. So that's a great place for a significant other to sleep. The room I'm in has this awesome, massive, massive, massive 2-person labor tub. So laboring in water is excellent for pain control. So at Genesis, you can walk, you can shower, you can take these big, big jacuzzi bathtubs. Yeah, you can. We have half midwives, half docs here. They will deliver you any which way you want to. You can't deliver underwater, but like right when the baby's ready to come, we just get you out of the water and then you deliver. Next, we have 2 computer screens there for the labor nurse. So that way we can chart in your room while we're taking care of you. Let me move here. Labor and delivery bed. This thing can do all different, oh my gosh, it can go in a million different positions. It can go like a chair where the whole back comes up, the whole thing rises up, the feet drop down, all that good stuff. And then for delivery, the end of the bed comes off. So we take off this part and then we take off that metal part so that it's kind of like, yeah, you can scoot your bottom down toward the end of the bed. But like I said, you can deliver anywhere in the room you want. We have to use technology. So if you're somebody who doesn't like technology, don't be a nurse. We chart on the computer, and then we do a lot with IV pumps. They're pretty easy to use though. We've got these cute cribs. So our little baby cribs here, which we just got all new cribs, and they rise up and down. They're really fun. So let me get back a little bit farther. So that is really cool. Every room's got a flat screen TV that's on a swivel. Most of the time the women aren't watching it. Sometimes their boyfriends are more interested in the TV than labor. We know how that goes. And then in every room, we have a setup for baby emergencies. So this is a warmer bed. It's got all the emergency equipment in case your baby comes out and is having difficulty breathing or difficulty with its heart. So we can perform all the resuscitation that we need here on the baby warmer. And we just have nice cupboards and storage and a sink. And then we have 2 fully functioning operating rooms up in labor and delivery. So if there's ever an emergency in one of your labor rooms like this, we just zip you right down the hall. No stairs, no elevators, nothing. It's down the hall. And then we can do your C-section right away. Oh, the bathroom. Real quick. The bathroom's kind of cute. It's dark. Sorry, I forgot to turn on the lights. There is this cute little, I don't know if you can see her, it's like a scalloped sink. So it's really shallow on this end, then it gets deeper. So we put these in on all of our rooms on labor and delivery and mother babies so that our babies can have their first bath in here. So we put towels down and their little heads just lay here, and it's just so stinking cute. And then this room just has a shower because it had that big jacuzzi tub out here. But some of our rooms have like jetted tubs if you want a jetted tub. So yeah, I just want to show you a room.
That is amazing. Like so cool. Thank you so much for doing that, because that is the hardest thing where we know that with the shortage and with COVID and with just everything going on right now, we don't always get to see. So oh my gosh, thank you so much. That was an extra little bonus.
Yeah.
So thank you. Well, Julie, you have an amazing rest of your day. Thank you so much for spending your morning with us.
Yeah, no problem. Bye-bye.
Bye.